Tobacco use, including vaping, has been in the news a lot lately, with over 2,000 cases of vaping-associated pulmonary illness and 39 deaths nationwide. While most of these cases have been linked to vaping of THC, vaping any product can potentially harm the user. 3 members of the Clinton County Tobacco Use Reduction Network, known as TURN, are here today to update us on the health concerns associated with smoking and vaping, efforts to reduce initiation of tobacco use, and to offer resources for those who want to quit. John Canoza is a director of public health in Clinton County. Rachel Danis is the reality check program coordinator at CFE, and Elise Rock is a registered nurse and certified cessation specialist at the University of Vermont, CVPH. Well, November is the time when we often talk about tobacco. Why is that?
So November is a great time to talk about tobacco because there is the Great American Smokeout Day, which takes place each year on the third Thursday of November. It's to help encourage Americans to stop smoking. It's funded by the American Cancer Society, and over 40 years of public health advocates have seized this day to focus on tobacco cessation and provide support for those who are trying to stop smoking and use other tobacco products as well.
And how does vaping fit in?
More recently, the FDA has deemed vaping a tobacco product, so while vaping products or electric cigarettes don't contain tobacco, they also contain nicotine, which is the addictive component. So nicotine contains products that are referred to as tobacco products because they contain nicotine and because of the similarities in how they are marketed to people and youth. Many people, including youth, have found themselves addicted to nicotine through practices of vaping, so they also need support and resources to help them quit. For example, one Juul pod contains 20 cigarettes, and we're seeing kids nowadays kicking a couple pods a day.
Aren't e-cigarettes used for cessation to help people quit?
Well, there's kind of two different conversations with e-cigarettes. There's youth and there's adults. So some smokers have used them to quit completely or switch from traditional tobacco products. However, vape products are not just being used by adults who are using it as a harm reduction. They're marketing to youth and kids, and there's been a dramatic rise in the youth vaping among young adults, about 78% in the past year with high schoolers. So the nicotine that's found in the traditional tobacco products are also found in most vape products. For example, a Juul is about 60% nicotine. So when a 13 or 14-year-old picks up a Juul, they become highly addicted to that product versus an adult using that as a harm reduction tool.
Wow. How many youth are we talking about?
A 2018 prevention needs assessment of middle school and high school students in Clinton County revealed 15% of 8th graders and 28% of 8th graders and 12th grader students are vaped within the past 30 days. The number who have ever vaped was even higher, so about 40% of high school seniors are now vaping. We see this, that the numbers in Clinton County are similar to what we're seeing nationwide, but might even be higher. So almost 30% of high school students are vaping, and that's really huge. That affects their brain development in a time that's really important. 13 to 18 is you haven't fully developed yet, so that increase in vaping is a huge concern.
Yes. What are some of the signs that your child might be addicted to nicotine?
Well, I first want to say that nicotine is so addictive that youth may be experiencing symptoms of withdrawal as soon as a couple weeks after first vaping. The signs include increased anxiety, depression, irritability, frustration, anger, maybe difficulty concentrating, restlessness, insomnia, nausea with a decreased appetite, and even weight loss and tingling sensations in the hands and feet. Another sign would be upper respiratory illness or an increase in the number of upper respiratory illnesses that you're seeing in your child. So the message that I really want to put out there is if you're a parent and you suspect your child is vaping, your child is going to need you as an ally. And they may not even realize they're addicted at this point, and so having a conversation might be a challenge. And even if they want to quit, it could be excruciatingly difficult. So having those conversations with them about, what they know about vaping, how they're feeling about it, and really letting them know that you're there and that help is available is a really good starting point. But really, showing support and concern and offering factual information and really connecting your child with their doctor to discuss medications and possible referrals to a nicotine addiction specialist that can help them quit is so important.
And what are some of the ways that we can protect youth?
Well, almost all those who smoke start before the age of 21. In fact, smokers often go from experimentation to addiction between the ages of 18 and 21. New York State lawmakers have raised the minimum legal age to purchase tobacco, including vape products, to 21. This goes into effect tomorrow, November 13th. The legislation aims to protect young people from the health harms associated with tobacco use and to keep them from developing nicotine addiction. Very important. Vape products are included, so individuals will need to be 21 years of age before they can legally purchase vape products. As of December 1st this year, all vape dealers must be registered annually within New York State in order to sell vape products. And as of December 1st, the legislature has enacted a 20% tax on retail sale of vape products sold in New York State. Increasing the tax of tobacco products makes them more difficult to afford, especially for youth.
Are there any other steps we can take locally to reduce smoking and vaping?
Yes, local communities can enact zoning regulations and limit the place, time, and manner in which tobacco products can be sold and advertised. Zoning and local licensing can be used to reduce youth exposure to tobacco marketing. Enacting smoke-free policies for outdoor spaces such as parks, playgrounds, and outdoor public areas limit where all tobacco products can be used. They can protect against secondhand smoke and help smokers quit. More and more communities and businesses are enacting those policies. As far as vaping, schools can make stricter policies for their students, do more education and awareness for parents as well, because it's not just water vapor. There's over 400 chemicals found in vapes.
If the legal minimum age of sale was 18 before, how come so many middle and high school students are vaping?
Well, kids can easily find different ways, other ways to obtain vape products. Internet sales or from friends. Parents should be aware that some teens are using credit card gift cards to purchase products online. There are also youth who get vape products from their parents. Many parents don't understand the danger. They think that vaping is safe when it's not. Nicotine harms the developing brain during adolescence, during the teen years. It also leads to addiction. The long-term health effects of vaping nicotine-only products without additives are not yet known, but we do know that most youth are not vaping nicotine-only flavored products. Substances used to add flavor or smoothness are mostly untested as inhalants. Vaping products are not yet regulated by the FDA. They can contain just about anything.
What resources are available to youth and adults who want to stop smoking or vaping?
So the first step would be to talk to your healthcare provider, who can usually connect you with a certified tobacco cessation specialist. There's also a great resource in the New York State Smokers Quit line, and that number is 1-866-NY-QUITS, and they offer free nicotine replacement products such as patch or the gum to smokers for years. But they also have begun to offer these products to adults who vape. For youth, some pediatricians are now prescribing nicotine replacement therapies such as the patch, the gum, and the lozenge. And there are also digital cessation support options such as Text to Quit from the Truth campaign.
And what else would you like our audience to know?
So there's more resources available, and some of the ones that I would mention are the Truth Initiative at www.truthinitiative.org. There's the Centers for Disease Control and Prevention at www.cdc.gov. There's the New York State Department of Health at www.health.ny.gov. And there's also the U.S. Food and Drug Administration at www.fda.gov.
Well, thank you very much. It's a lot of really great information there. And
Thank you.
you have
Thank
yourselves
you.
a wonderful day, and thanks for coming.
Thanks
Thank
again.
you.
Thank you.